Good morning, everybody. Welcome to Driving Health, our series on the results from the Driving Health study. Fantastic to have you here today. So this is the third of 6 webinars on the results from the 3-year study. We're up to the 3rd year. We've been going for 2 and a bit years. We're up to giving you some results from the 2.5 years so far of the Driving Health study. And as I said, it's fantastic to have you here today to be part of this webinar. And the replay is also going to be on our website in the next 2 or 3 days as well, if you've got contacts who haven't been able to make the live webinar. So the extent of the results and the data and the info that we have gathered over the last 2 and a bit years has been pretty extensive. And so we've sliced those up into little chunks of important meaning and little chunks of topics so that we can give you some highlights of the results and also talk about what comes next. So the next part of what comes next in the Driving Health study is the implementation program. And so we're going to talk a little bit about that as well going forward and how you could be part of that to enhance the industry and to keep drivers healthy and safe at work and to promote and maintain their health and well-being. So without any further ado, I would love to introduce our guest speaker today, who is speaking on driving with a health condition. We've got 6 of them. I had to make sure I had it in the right order. So I'd love to introduce you to Dr. Ting Jia. Now, up until recently, Ting has been a driving force, sorry for the pun, in the Driving Health team and worked very closely with us all around data analysis of different aspects of the data. And now she's moved in as a research fellow to Monash Addiction Research Centre. So she's still involved with us and she's still very much part of the information and the data and the analysis that she's presenting today. So welcome, Dr. Ting Jia, and I will hand over to you. And we got time for questions at the end. I forgot to do this, I'll tell you housekeeping. Questions at the end, we'll have about around 10 minutes for questions. So make sure you find out where your chat box is on the webinar or the Q&A page, and you can put the questions in as we go through and we'll be answering those in the end. So thanks, Ting. I'll hand over to you.
Thank you, Elizabeth. Thank you. Good morning, everyone. Today, it is a great pleasure for me to represent our Driving Health team to have the 3rd webinar focus on our findings on the health condition among Australia truck drivers. Sorry, what's going on? Yep. For those who attend our webinar for the first time, I'm going to have a quick introduction of the Driving Health project. So the Driving Health project is a 3-year research partnership with our group and the New South Wales Centre for LINFOX, New South Wales Centre for Work Health and Safety, and the Transport Worker Uni, which is also fund supported by the National Health and Medical Research Council Partnership Project Scheme. To our own knowledge, it is the largest Australia-based study focusing on the health and the well-being of truck drivers. Well, there is a large body of the research coming from other countries like North America or Europe, and we believe it is critical to have evidence that represents the Australian drivers working under Australian conditions. And our study has examined multiple sources of data to inform our finding. Some of this come from existing data source. For example, we analysis about like 120,000 accepted claims for workers' compensation, and some it involves using the data source for the first time. We analysis like 3,500 death benefit claims from the largest industry, superannuation fund for the workers in the transport industry. And apart from the administrative data, we also generate new data by engaging with truck drivers themselves. And we conduct online survey of more than 1,400 truck drivers and a telephone interview of over 300 truck drivers. And lastly, we conduct in-depth interviews with the drivers and their family members. All of this combined has given us a clear picture of the health and well-being of Australian truck drivers that we believe it's representative of the Aussie truck drivers, and including a range of different ages and owner and employee drivers, short-haul and long-haul drivers across the country. Those quotes are from a truck driver in Sydney, Philip Costin, who has been subcontracting to the same company for the last 64 years, including 40 years driving interstate. And he said, I've got back issues, rheumatoid arthritis, and I got a heart attack. Most of the thing I got, I think, are related to the job because of the stress. And trucks are not the most comfortable vehicle, and the constant vibration and pounding, changing types and things like that. So what are the most common chronic health conditions among our truck drivers? According to the finding from our online survey, over a third of the drivers reported receiving a diagnosis of back problems, and making it the most common chronic conditions in our sample. And this is similar to our previous finding on the compensation data that musculoskeletal injury was the most common type of work-related injury. The second common chronic condition was blood pressure, reported by 25% of our sample, and mental health problems such as depression and anxiety were also common, with 19.4% reporting a diagnosis in the last year. And if we look at the number of diagnosed condition, only 25% of truck drivers in our sample reported having no diagnosed chronic condition, and compared with 54 in the general Australian population. And nearly 50% of the truck driver had more than 2 of diagnosed chronic health condition, which is more than 2.5%, the percentage of the general Australian population. In addition, our analysis on the life insurance data revealed that heart disease and cancer were the leading cause of non-work related deaths for transport workers over 40 years old, and for drivers under the age of 39 years old. External cause of injury and suicide were the first and second cause of non-work related death. Interviews with drivers indicate that their companies are more interested in drug and alcohol than doing blood pressure and sugar testing, and any one of those 4 is as bad as each other, and they don't worry about that. We also looked at how diagnosed chronic condition impacting their health and driving outcomes. In brief, a diagnosis of 3 or more health condition was associated with increased odds of a driver having poor outcomes. Specifically, compared with the drivers with no chronic condition, drivers with 3 or more diagnostic chronic condition increased the odds of being in the poor health, severe pain less than 1 year, and severe psychological distress by almost 8 times. However, drivers with 3 or more chronic conditions were found to be associated with reduced odds of having a higher health utility score relative to drivers with no conditions. In addition, a diagnosis of 3 or more health condition was also associated with poor driving outcomes, with 1.5 times increased odds of experience a crash and 3 times increased odds of having more than 10 near misses a week. Lastly, having more diagnosed condition increased the odds of having poor workability by 6.4 times. Quoting one of the drivers we interviewed, he said, drivers have gotten realized that the body needs to move. You got to expect fatigue and chronic disease. Both can be fixed with a bit of exercise. Overall, our finding from the Driving House project showed that compared to the general Australian population, truck driver had poor physical health, and you may have seen more evidence from our previous webinar and in the next few webinars. The significance of having multiple chronic conditions is not surprising when considering the general health and the health-related quality of life. However, having those like 3 or more chronic conditions, doubling the odds of experience a crash. Therefore, not only is the management of chronic health condition of high importance for drivers, so are preventive efforts to reduce the risk of drivers developing the multiple chronic health condition. And as you may aware, men seek help for physical and mental health problems less often than women, and delay in the treatment can have a negative influence on the future course of the disease. Therefore, truck drivers should be encouraged to seek help in the early stage and don't wait till it gets really bad. Secondly, eating a healthy diet and getting regular exercise are the base of prevention of many chronic conditions such as diabetes, mental health, and cardiovascular disease. By decreasing like sugars and fats and increasing physical activity each day, your health risk are lessened. However, the long hours on the road reported in this survey impact access to the fresh food and the opportunity to exercise. And unpredictable work shift and working through the night means that accessing the health professional can be a challenge. The major of the driver completing our survey were employee drivers rather than owner drivers, suggesting there may be a role to play for the employer to devote increased resources to driver health and well-being. Helping drivers to be healthy and stay healthy at work will not only benefit employees, but will likely improve their performance at work as well. And third, actively seeking help it's needed. The truck driver need to contact a trained professional for regular health check and identify how to decrease your health risks. And we know there are currently a number of interventions available aiming improve health of the drivers in Australia. And a scan of those interventions currently in place across Australia suggests that the majority are targeted at driver's burden of responsibility on their shoulders. And there are some worker-focused approach out there will help. And our research suggests there is clear role for intervention target at other levels and stakeholders in the transport industry, and companies and employer are an important part of supporting drivers to be healthy and stay healthy at work. This is why our Driving House team, in partnership with industry bodies, has developed the Driving House Allocator Training Program, DHAT. So in October, we are launching a short 20 minutes online training program for people employed in the supervision of the truck drivers, for example, allocators, line managers, and supervisors. This program aims to increase the knowledge of supervisors on all the factors impact drivers' health and well-being, and important, raising awareness on the factors that supervisors have control over that will not only support driver health and well-being and ultimately improve their driving performance and workability. Well, many people think, well, it is just up to the driver to be healthy and stay healthy. But we know from our almost 3 years of research that solution are complex and require a multi-plonger approach. It's not just about the driver. It is also about the industry, the regulations, and the way each company works with and support the drivers as well. If you are interested in finding out more, you can click on the link and sign up now to register your interest in the training program online. Once the resources is online, anyone can register and complete this. So we encourage you to share this with your colleague and your employee that you think may find this helpful. Lastly, we have to thank the truck drivers that contribute to this huge body of research. We can only hope that with this program, we can give back by creating healthy working lives for truck drivers and their companies. We should also like to extend our thanks to our collaborators for those ongoing support. And thank you all for attending today. And please free to email us if you have ask for any reports and resources mentioned today, or find all the content on our website. And we will now open up for questions. If you have any questions, and put them into the chat box, or you can raise your hand.
Wonderful. So we've got questions starting to come in, and I'm also going to bring in Associate Professor Ross Iles as well, who's online with us, and he's part of our team. And so he's going to be here to help answer the questions as well. So thank you, Ting, for that information. And the first question we have is from Vincent. The cabin of heavy vehicle is, hang on a sec, the working environment of the driver. As a statement, more of a question. Companies do so much to look after the staff and their ergonomics and in how they sit and how they look in relation to computers, but heavy vehicle manufacturers don't seem to have a focus for our drivers in comparison. So thank you for that statement. And yes, as we have been interviewing people and finding out more about what's happening with them in relation to the questions that we asked online and the online survey, and also in the telephone survey, and then in the in-depth interviews, they definitely said that there's a whole lot of vibration happening. And even if they have got the state-of-the-art trucks, there's still that ongoing impact that they find on health, as well as the sedentary workplace as well. Any other questions around, any other comments, Ting or Ross, around the actual environment of the truck environment on the impact of health?
I'll jump in, Elizabeth, if that's okay. No, thanks very much for that question, Vincent. It is, it's very true when we think of work environment, that for the truck drivers, it is, very much the cabin, but then also the warehouses where they need to load and unload as well. So they actually have quite a shifting work environment as well, and I think that can be a challenge. And I've certainly spoken to drivers who talk about how the space for the driver is often a lower priority than actually making sure there's enough room for cargo in terms of, particularly if it's a sleeper cabin, for example. So we know that's a real challenge, and we know that certainly I believe we need to be prioritising the health of the driver to make sure that they can actually perform their job safely. What the results that Ting talked about today is that actually having multiple health conditions actually impacts the driver's ability to drive. They're more likely to be involved in a crash. They're more likely to have near misses. So they actually self-rate their workability as lower if they have multiple health conditions. So it's not just a matter of just keeping the drivers healthy. It's actually helping them perform if we can actually help them to avoid those health conditions.
Mm.
I also think like the change of or the improve of the cabin, it's like it's not like something can happen next day, but like I think for drivers, if you can kind of like have regular break and doing something, like I think you can kind of like recovery from those vibration at least quickly.
Yeah, definitely. Okay, and we've got another statement. Is there any data, question? Is there any data or findings shared with the insurance companies to give transport companies incentives to change the culture and business behaviours to make the roads safer?
What an interesting question.
Yeah. Let's go for incentives. I like that.
We are certainly interested in providing our findings to anyone who's interested. They're all available on drivinghealth.net. And also the driving health reports were featured in the recent Senate inquiry into the sustainability of the transport sector. And certainly that finding put forward a number of recommendations that are actually that involve changing culture and business behaviours to make the roads safer and healthier. So,
anything to add, team, on the insurance incentives making roads safer?
Yeah, we have already provided our findings to the TWU Super, and this maybe can happen in the future.
Awesome. Cool. So we've got a question from Nicole, and just before I do that, just make sure that if you're interested in supporting drivers further, remember that we are rolling out the intervention coming in October, and this is just a 20-minute online intervention for allocators, line managers or supervisors, and we would love you to be part of that. We've already got a whole lot of people signed up and interested in being part of this, so we would love you to be part of this as well, because we want to support you, make your jobs easier, and so you can identify those factors that as a line manager, supervisor or allocator or whatever it's called in your company, that you're able to support drivers' health right across the gambit in more effective ways, and make it even easier for you, because if the drivers are healthier, then you don't have to cover shifts or shift things around. So we're thinking of that as well. So hop into the link in the chat box, or else you can do it on our website as well. So we've got a question from Nicole. Is there a recommended ergonomics training as far as individual setup? Not, I'll answer a little bit of that. We haven't got that specifically from our perspective. I know that the occupational safety and health training, there are some basics around setup, and I also know that PACAR, as part of their training for drivers, that there's recommendations, but beyond that, from Monash University and from the study, we haven't focused on that specifically.
And just to add to that, Elizabeth, we'd be really, if people do have an idea of what that is, and have some evidence-based information they would like to share, we'd be more than happy to share that through Driving Health. If people have the ideal setup, by all means get in touch with us, info@drivinghealth.net. We'd be more than happy to provide that as a resource to people if they're looking to support their drivers. We're all about that, and we'll more than willing to help spread that good information.
Yeah, absolutely. Great. So we've got a statement from Vincent. Yeah, sounds like your findings. Drivers need more comfortable seats. Some of the drivers responded and stated they had the state of the art. Others said, yeah, they do. Some had the anti-vibration things. Some of that was broken. So there was a whole gambit and different was experienced across the people that we talked with. But yes, there's room for improvement, definitely, physically as in what we do, and also the physical environment. So I think, Ross, I think you've got a question from somebody who's asked a question previously.
A question that we've had previously that's come through has been, where do we think why it is that we think that having multiple health conditions actually influences drivers' ability to work? I'm happy to answer it, but I asked it, so I think
Go team, you start first.
Yeah, because I think that because I'm a data person, so according to the model, because we adjusted for many other factors in our model to see how the external factors impact drivers' health and driving performance by adjusting like age and other demographic factors, and the multiple condition jumped as a very significant predictor of their health and driving outcomes. So I think like when we look at all the factors in all, we should focus on those factors have the biggest impact.
Awesome.
To put that another way, Ting, you're saying that even when we think about all the different ways drivers could get paid, the types of work that they do, whether it be long haul or short haul, or staying at home, or getting home at the end of the day, that actually helping them to be healthy is actually going to have the largest possible impact on their driving performance compared to all those other things.
Yeah.
And I think that's a really important message that we've got here. And a number of the conditions that we are talking about in our research are those long-term health conditions that need a long-term approach to fixing them. It's not a take a pill and it's sorted. A lot of them can. A lot of the evidence points towards interventions that are about healthy diet and regular exercise, which we know are a real challenge for drivers to be able to incorporate into their everyday routines. And it was just this morning I was reading a Twitter feed from a driver in the UK who said, well, he had his 15-minute break. He was sitting in the same seat for that whole 15 minutes, just scrolling through his Twitter feed. But that was his rest. That's the time he was required to rest, so he wasn't fatigued when he drove. So we know there are challenges to actually turning that rest time into genuine rest time, and then also exercise into genuine exercise time. And then and we've talked previously in our other webinars about access to healthy food. Now, Elizabeth, I can see some other questions coming.
There's some other questions coming out. So we've got one from Avril. Were there any interventions or education programs that were identified as effective? I'll start this one because we did a systematic review around this as well. So there were a couple of programs that were identified as effective with a small number of people short term. They didn't do long-term longitudinal studies. Any studies in the world of research needs to be funded, and so some of these have done the first part of it, and we were looking at what could we use from that information to look at how to support the driving health industry in Australia going forward. So there were some interventions, and the educational programs, there wasn't a lot of evaluation of the educational programs. There was a couple of programs that were sort of multi-pronged, where they did some educational work, some resources, and also one of them, they had some motivational interviewing coaching. So they had sort of one-on-one coaching with the drivers, and the ones that did those sorts of things appeared to have better outcomes on people's health and weight and health conditions and overall health and well-being. However, there's not a lot of long-term research in this area. That's why we're looking at what can we do here in Australia as well. So the intervention that we're created to roll out in October, it's the beginning. It's the beginning of that multi-pronged approach. We've got some amazing programs happening towards the drivers, targeted towards the drivers, as Ting said. And so we're looking at going in for the multi-prong. We're looking at coming in for the allocators, line managers, supervisors, and increasing awareness, understanding of the factors that they can be involved in as well. Because let's face it, they're not out on the road with the driver in their 15-minute break or their 7-hour break overnight or whatever it is, or during the day. And so it's like, how do we support these drivers? Because it's not all just up to them. There's so many other factors. Okay, we had another question from Philippa. What are the issues or risks for a company who has drivers who weigh more than the seat weight capacity of the truck that they're driving?
Elizabeth, I think you missed.
Yeah, I'll come back to that one. I'll come back to that one. Yeah. So what are the issues or risks of a company when the driver has a driver who weighs more than the seat weight capacity? We got any comments on that?
I see that as a real challenge for the companies, Elizabeth. I'm not from the transport industry myself, so I've never driven a truck. Although, yeah, people have said I look like a truck driver. I think they were taking, but I think that does pose a real challenge to the company who really wants to look after their drivers, but then also has the pressure of, well, that then they need to keep the trucks operating. And it can potentially put their driver at greater risk of poor health as a result. It's a challenge because it requires investment in, I guess, a new seat if that's possible. And again, I'm not across what the options are, but it's a challenge for companies. And I think short-term fix is to replace the seat. The long-term fix is to help that driver to be at a healthy weight.
Absolutely. And I'm aware of time. I'm just going to take the one last question that came in from Vincent. It was like, read the high levels of pain with drivers. Is there any evidence from the interviews on usage of drugs and alcohol to help them manage pain?
I think according to our survey study, it's only like small portion of the driver reported the using drugs and alcohol to manage their pain. I don't know whether it's because it's underreported or it was the truth, but for any other aspect, like for example, like opioid, it's not recommended for chronic pain for long-term use. So it is not the solution.
Absolutely. Yeah. And we know that it's complex. We know that it's not a simple fix. It's not just put this driver on a diet and everything's fine. It's not about that, because it's hugely complex. And as Lindy was just saying here, she's had a driver in an incident like this, and they help support the driver to become healthier. And yeah, that's part of the solution, but it's not the only problem. There's a whole lot of things. There's the whole of the industry, the actual way the shifts are done, the environments on the road and out of the road and in the truck. There's a whole gambit of issues that we know contribute to the overall health and well-being, or the lack of health and well-being of our driver. So thank you so much for being here. We know this is just a little touch point around health conditions. For the full reports, you can go to our website, drivinghealth.net. You can register for the intervention there. You can also contact us if you're wanting specific information, info@drivinghealth.net. We thank you so much for being here today. Thank you for your comments that are just popping in as well. Thank you so much. I'm going to grab that before it disappears. And we look forward to seeing you on Thursday if you're around on Thursday, and that's about muscles, joints and driving. So thank you so much for being here. Goodbye.
Thanks, everyone.
Thank you. Bye.